There's a smart reporting system in LOTS that assesses patient compliance. This can be done individually, patient by patient, or by a group of patients, which you can then call or mark for later follow-up. The LTC report is shown here from the main dispensary menu under Patient Care. There's 3 different options here, but for the moment we'll just use the LTC compliance report. The main purpose of this report is to give you a group of patients to identify. There are a few selection criteria you can use depending on what information you want to pull out. By leaving this patient name area blank means you'll get a list of patients. Then amend the date field and run the report. This is really useful as you can mark them all as possible LTC patients very quickly, and this will prompt you next time they visit. Here the report shows patients that have 1 or more LTCs and their compliance score. Clearly some of these patients are not going to be applicable, but you can sort this column and you can get the lowest scored patients first. You'll soon trust the scoring system that LOTS gives you, but if you want to see how this is calculated, you can move over to the non-compliant script box to see exactly how the score is calculated. It's very easy to see numerically where the patient is slipping. Another way to view a patient is the compliance graph. Click here. This highlights the entire history for that patient and is great for seeing the bigger picture. If you haven't used this graph before, you'll use it a lot now. Going back a step to the selection box, you can enter just one patient's name. This is helpful if you're just wanting to assess this one particular patient. So assessing compliance is that easy. Once identified, you can move your selected patient to the assessment stage by clicking the LTC Service Patient Eligibility Assessment shown here. LOTS has made that step really easy too, so you're quickly moving through the whole process to get to the patient registration and finally setting the management plan. And we'll cover this in the next help session.